on the far right bottom, I can't see who the next to Greg Bajati.
Someone named Sabrina or something. Sabrina.
Hey, Eastern Oregon and Union County, we are glad to be here with you today at this COVID-19 Union County press conference. And I am here joined by the three main entities in the area that are helping us navigate this, and also myself from Eastern Oregon Live TV and Sabrina from The Observer. And we really appreciate you guys taking the time to be here. So Matt, why don't you start first and introduce yourself and kind of talk to us about your role in this for people that don't know you, who you are.
Yes, I'm Matt Scarfo, Union County Commissioner. Right now I'm liaison for public service, which includes the COVID-19. And I just would like to say thanks, Brent, for doing this. And hey, good to see everybody. I haven't seen you guys like in a week or so. What have you been doing? Oh, you want me to elaborate more? Or?
No, that's good. All right, Carrie, take it away. Tell us what's your position and what you do.
Yeah, I want to reiterate the thanks for having us be able to share information today in this format. It's really great to have all of us together to provide information to the community. So my name is Carrie Bergiotti. I'm the Public Health Administrator at Union County, and I work at the Center for Human Development. And my role in all of this is to support the public health response that we have in Union County to COVID-19. So I'm working with our partners to do all that we can to protect our community and keep the members of Union County safe.
All right, and Grand Ronde Hospital, introduce yourselves to us. Oh, no, sorry. Okay, go.
All right, my name is Jeremy Davis, President and CEO for Grand Ronde Hospital and Clinics. Joined with me, I have Dr. Susan Rice, a longtime internist here in La Grande, and then Elaine La Rochelle, who serves as our Technical Services Director and also is our Incident Commander at the present time.
All right. Well, Jeremy, since you are, since Grand Ronde Hospital is kind of at the center of taking care of us and providing for us, why don't you guys start? Tell us, and however you want to pass that off, Jeremy, tell us the things and the questions that you're hearing most often, and how you would respond to the public with those answers.
Sure, sure. Well, first off, I want to share that our spirits are high. Our staff has truly been humbled by the outpouring of support and the well wishes from the community. The health and wellness in the community that we serve is something we take seriously. And really, it's a team sport and something that I know and I'm confident that we'll be able to get through together. Certainly, as this is an unprecedented pandemic evolves, our needs may change, and we're committed to communicating with the community through traditional communication channels as well as social media. One thing I do want to point out to the community is that we have set up a web page on our website. Go to grh.org/COVID-19. You'll find information that we put out to help provide communication to the community. One immediate opportunity is there is a LeGrand community blood drive that's being held on Tuesday, March 31st, from 12 p.m. to 6 p.m. at the Church of Jesus Christ of Latter-day Saints building there on Geckler Lane. There's a concern nationally that the blood supply is going to be limited as a result of various events being canceled throughout the country and folks just not donating. So please join me in donating. I did hear today, though, that they've filled up all their slots. So now they're looking for folks that can be on standby in case somebody has to cancel. And so really, I think LeGrand and Union County can really step up and do our part to make sure that we have adequate blood supply. Because, when you think about this COVID-19 response, regular life still happens. There are still traumas, there are still car accidents, and there are still medical emergencies in which blood is needed. So the community, I think, can really step up and help us in that regard. And you can find out more information if you go to our Facebook page. So one of the things that we hear or we're getting asked a lot is, why is social distancing and why is sheltering in place so important? And really, as I think about this is really a systems approach to health from a micro as well as a macro level. I would say that everything that our community and region, especially Northeast Oregon, can do to help flatten that curve. I'm sure many of you have seen that curve either on social media or on other reputable websites. Anything that you can do to help flatten that curve and buy time for our healthcare facilities and our staff to adequately respond to what is expected to be a large surge of critically ill patients will be very helpful. We know it's an inconvenience. All of our lives have been impacted because of this. The reality is that we want to put ourselves in the best position possible to take care of you when you need us most. And so doing your part, washing your hands, social distancing and so forth is very helpful. Another question that we get quite frequently is, what is Grand Ronde Hospital doing to protect our patients and staff? And this is an evolving, very fluid situation as guidance continues to change from both CDC as well as Oregon Health Authority officials. We've implemented a variety of steps. First, we've restricted all of our entrances, so we only have one entrance into the hospital. We've implemented visitor restrictions. Essentially, we're allowing no visitors unless we do have modified plans in place for laboring mothers, visitors in end-of-life situations, as well as pediatric patients, as well as those with disabilities. We've also implemented enhanced screening protocols for patients, as well as for our own employees who are coming to work to be here to take care of you. We've increased our internal communications with our staff. We've also set up an internal web page for our staff to more effectively communicate. We've also modified some of our meetings to adopt social distancing practices within our facility as well. And really, at the end of the day, I think for the community, the main thing is, if you think that you need to be tested, please call ahead, call your doctor, and let them run through the protocol so that way we can systematically and efficiently handle your care. And then lastly, a common question that we're getting is, can your care provider continue to see you for wellness visits? And the answer is yes. If the visit does not require personal protective equipment and we've implemented appropriate screenings in place, we can see you. We know that the healthcare needs of every individual is very personal, and thus the individual health and wellness needs of the community we serve does not stop in a situation like this. We want to take respected and common sense approaches to this, but we also know that life continues to go on and people continue to have health issues that need to be addressed, so that way we can hopefully keep those patients out of our ER. So, the recent executive order by the governor really stated it pretty simply, and it allows healthcare providers to use their judgment in what procedures should be canceled or delayed to protect human life. And so really, we've empowered our medical staff to make those case-by-case, patient-by-patient decisions in terms of whether a scheduled appointment needs to continue to be held or whether it can be rescheduled. So, really, accidents happen, births happen, illnesses happen, and Grand Ron's going to be here every step of the way.
Excellent, thank you. And for our viewers, if you have a question, you might, and you want to pose that on Facebook, then if those questions are not answered by the panel, then we will funnel that to them as we continue on. So Jeremy, introduce us to the next person, please. Take it away.
Actually, I'll turn it back to you so you can share it with another panelist.
Okay. All right, Matt, why don't you, or let's see. Yeah, go ahead, Matt. And if you have a follow-up question, maybe let's just kind of go through, we'll have everybody talk, and then if there's some questions that are not answered, then we'll come back and answer them. So
yeah, I'm really going to just leave the medical questions and answers to CHD and the hospital. I'm not going to pretend I know all that, so I'll just go leave that to them. What I'm going to touch on is more of Union County citizens and their well-being and what I think they need to do, because this is, we've never been under kind of a shelter in place. I can't use shelter in place, but in order like this to stay away from each other. So there's a few things that I think are very important. We're trying to really keep the motto of take care of each other. Just, one another. Let's, I say stick together, but I got to really watch out, social distancing, stick together and check on one another. I'm not one time either. It's like, oh, I went and checked on Henry last week. We're good. No, make a habit of it. Continually check on people. Because as this goes on, people get lonely and bored and it's not good for anybody. A couple other small things, but just to relate to the citizens of Union County, don't binge watch all your Netflix shows in one night. Like, this is going to be like weeks, structure yourself to a couple and, really, get up and exercise. They say an hour a day, but now you're not going to work or anything. So try to do it a couple hours a day. Get out when the weather was good. I mean, the snow now, didn't see too many joggers today, but everyone's walking their dogs. Everyone's dogs must be just loving this right now. Take your dogs out. Enjoy. I mean, we're Union County. We're Eastern Oregon. That's why you live here. Get outside, get some fresh air, get the blood moving, stay positive. There's so much negativity going on right now, and it sickens me. I get on social media. I'm not a big fan of it anyway, but I'm kind of glad it's here just for communication. But the back and forth, it's not good for anybody. And then the sleeping habits. Try to go to bed at a certain time. Wake up at the same time. And then of course I'm definitely into businesses. I own some businesses downtown, so I feel the pain of everybody else. Shop local, please. I know a lot of businesses just closed. Make sure you call them, Facebook them. Hey, I know you're closed, but can I buy something? I need to do this. I'm actually, personally, I'm shopping for a new bow. because I know I'm probably gonna have to fill my freezer come fall. So and I got to start practicing. I mean, stuff like that. Please, keep it going. And then on the business side of things, track, if you're a business owner, track all of your costs and expenses. The package that the federal government's trying to put together, we don't know what they're going to ask. So make sure you write everything down, all your losses. If you're a restaurant, everything that spoils, just make sure you got it, because you may have to show what you lost to get refunded on that, if there is refunds. The other thing, I just received an email from Senator Wyden's office. This is some actually good news. They're looking at extending unemployment insurance to self-employed businesses and stuff. So hairdressers and things like that. The restaurant people, we've already been hurting for a week on this, and we missed out on a week's worth of unemployment that we could have got. But I'm following this very, very closely, and call me on I'll be in my office. I'll try to be here as much as I can, mostly in the mornings. Afternoon, I'm usually on my phone nonstop. 541-963-1001. I'm also posting a lot of information. I don't know if you guys saw that on my Matt Scarfo, or oh boy, what is my Facebook? Matt Scarfo for Union County Commissioner. A lot of questions about downtown parking. I'm going to post that. So as questions come to me, I'm going to start. I'm not really good at social media, but I'm going to start posting a lot. And then also the JIC. The JIC's very, very important. They're putting out very, very good stuff every single day. And that's Northeast Oregon Joint Information Center. And their email is neoregonjic@gmail.com. And they also have a Facebook page, which I think if you just start searching Northeast Oregon, I'm sorry, it's probably NE Oregon Joint Information, then great stuff there also. The JIC did want me to report that we are going to be getting in a shipment of supplies tomorrow, and they'll be coming in on National Guard trucks. So don't be scared that martial law is coming. They're actually coming with equipment for us. So I mean, I already know everybody's, I'm seeing everything. Oh, a plane flew over, and it's, I don't even want to get rumors going, but just, stuff like that. I know how it gets, but like I said, take care of one another. And I think that's, we also started weekly mayor teleconference meetings. Our first one was Monday, and it was fantastic. Carrie was on the line, all the mayors, and we're going to try to expand that out. And we're going to have them weekly, but if something pops up, we're going to have them as needed as well. And the information, I've been always a big fan of communication. The more we communicate, the better. And like the Rumorville and all that. So we're trying to get everybody on the same page with the same information, with the same numbers. And like I said before, Brent, what you're doing right here, this is fantastic, and everyone needs to know that. So I think I hit everything that. The JIC phone number, if you want to reach them directly, 541-963-1098. And if there's any other information, please call me. Facebook me, email me. My email is mscarfo at union-county.org.
Okay.
And that's all I got. I'm
Good.
sorry.
Hey, no. So real quick, just to follow up, then we'll go on. So what are the supplies that are coming in?
I am actually sitting here with a JIC member, Annette Powers, and I will ask her, what do we got coming in?
We've got some emergency cots, blankets, things like that, should the need arise that we need to have them.
Okay. Did you hear that?
Repeat that, will you?
Okay. Cots, blankets.
Linens, those kind of
Linens.
things, should we need them
Yeah.
for emergency
Okay.
need.
All right.
It's not martial law. As you know, that people are going to be, here they come. They're coming for us. No.
All right. Good. All right. So, Carrie, take it away.
Thank you. Commissioner Scarfo, I really appreciate your comments and your attitude. I think it's there's a lot of anxiety, a lot of fear. People are really nervous, scared. There's a lot of uncertainty going on right now. And I think that your comments reminded me of two things that we really have going for us in Eastern Oregon, that we do look out for each other. We do know our neighbors. We do work very, very closely together, which is part of why all of us on this call have been working together, or on this video right now, have been working together pretty tirelessly to make sure that we're as prepared as possible and that we are able to take care of the community when they need us the most. So as you said, take care of each other. I think we're really good at doing that in Eastern Oregon. And so it's one of the reasons why we do choose to live here. And again, I really appreciate your comments about getting outside too. We're fortunate that we live in a place where we can do that. So I think it's a great reminder for us that we don't have to stay in our houses. We don't have to be inside all the time. We just need to try and keep our distance from people that are not part of our immediate family group, keep our distance from people that are sick, so we minimize the spread of the disease. And, I think some of you have touched on the social distancing, but I think it's really important to reiterate why that's important, because we do not want to overwhelm our hospital to the point where if we do have people in our community that become severely ill, that the hospital isn't able to take care of them. And so by staying home, by reducing our interactions with other people in a way that reduces the risk that we will spread the disease to them, by staying home when we're sick, by doing all the things you've heard a million times to do, like washing your hands. I mean, I know people are like, I don't need you to tell me to wash my hands again. But in the absence of a specific treatment for this disease, and in the absence of a vaccine for this disease, this is literally the best tool we have in our toolbox right now. Social distancing, basic everyday preventive practices. So that's why we keep saying it over again, because it literally is the best way that we can save people's lives. So I think that, obviously we get a lot of questions about how many cases we have in Union County. Like, everybody wants to know that. And I think, we will share that information when it changes. We update our website, chdinc.org/COVID-19. There will be updated numbers on there, as well as on the Oregon Health Authority website, which publishes the number of cases that are in Union County and the number of negative test results that are specific to Union County. So you can always go there and get the most up-to-date information. And I was talking to somebody today, and I think, we're sharing that information pretty close to when we're getting that information. So I think the community should know that we're not finding out a week ahead of that information being shared with the community. We may learn of it 2 hours before it's on the Oregon Health Authority website. And the way that testing is being done now, if a private provider orders the test, like if Dr. Rice orders that test for one of her patients, she may find out about it before the health department does. So, I think the way information is being shared, we just have to remember that we're getting it out as soon as we can, and there's usually not a lot of lag time. Obviously, one of the questions that we're getting the most is about testing. People want to know whether or not they have this disease. People want to know if, when they're sick, if this is what's causing their illness. And unfortunately, given the way things are playing out right now, we just don't have the capacity to test everybody that wants it. And I think, we're getting information from the Oregon Health Authority today that really the Oregon State Public Health Lab is going to continue to limit the testing that they're doing. And we're really being encouraged to even have tests done by commercial labs be really restricted to people that are severely ill. And that if you're not requiring medical care, that we're not recommending that you need a test, that we're really reserving the testing for people that have that have a need for medical care. And the State Public Health Lab, it will really only be people that are hospitalized. And I just want to acknowledge that that's hard for people. I want to acknowledge that people want that information, and it's really hard not to be able to give that to everybody. But unfortunately, right now, it's not feasible. And I think the other message I want to share with people is that it doesn't necessarily change the information of whether or not you get a positive test result. It doesn't really change what we're going to advise you to do. And, maybe our healthcare providers on the conference would like to address this more specifically, but if you're a contact to a case, if you're not in need of hospitalization, we're going to tell you to stay home. We're going to tell you to manage your symptoms at home until you need to be treated in a way that you cannot manage yourself at home. So even if you're identified as a contact to a confirmed case, we're going to tell you to monitor your symptoms at home. We're going to tell you what to look out for, which, all of this information is already out there anyway, and I'm sure many of us are doing it anyway. So I understand the frustration and limitations. And again, I think that's the most commonly asked question that I'm hearing at this time. I think, again, part of in public health, our response is to, identify cases of disease to minimize the spread, and then also to share information. So we're trying really hard to share information on our website. I already said the URL, but it's chdinc.org/COVID-19. We do our best to update that daily. It may not always be updated daily if we don't have new information to share, but we're doing our best. And we're also really sharing a lot of information on our social media. So Facebook and Instagram are great ways to get the most current information from public health. And I think with that, I will go ahead and pause there, because I think I'd like to spend time responding to questions that people have that we haven't addressed, rather than assuming what they're wondering. So thanks for the time.
Okay, thank you very much. And let me put a couple of questions to you. So you said that information is available on a particular website. Give us the most recent information. How many tests have been done? How many have negative? I mean, as far as we know, we still only have one. I don't know, go over those. Tell us what those results are. Brief us on, give us that most recent information. I'm sorry, you're muted. Let me.
Sorry, I thought
Okay.
I thought I clicked the button. I apologize. So like I said, all of this information can be found on the Oregon Health Authority's website. Just currently, as of 9 a.m. today, there are 266 positive test results in the state of Oregon. For Union County, you can see on that website that we have one confirmed case, and they're also reporting that there are 14 negative test results for our county. Now, that it's likely that there are other test results pending. We don't really know the numbers of pending results, because the healthcare providers aren't required to notify us when they're conducting a test. So we really only know when it comes back positive and negative, which is reported on that statewide website.
Okay, but just to kind of summarize what I think you were saying is that there is the possibility that if somebody does not meet the criteria for testing, they could actually have COVID-19, move through it, isolate themselves with the social distancing things that they're supposed to be doing, and move through it. And we might not ever know that they really had it, but they because they're sick, they're just responding in a responsible way as though they do have it. Correct?
Yeah, I mean, I think that we were on a call with with some physicians at the Oregon Health Authority yesterday, and they were basically saying at this point we should just assume that everybody has it, because we're not going to be able to test everybody that's symptomatic. You're not going to know if somebody that you come into contact with actually has that disease or has a common cold. So, I think we just need to keep taking those precautions. If we're sick, 80% of the people that have COVID-19 have a mild illness. They can recover easily at home, just like they would with a common cold. So our focus right now in public health, and our focus, I assume, for healthcare, I don't want to speak for them, is on the high risk populations that are really most likely to have an adverse outcome from the illness or have a very severe illness that.
Did I lose you? I think we lost Carrie, but hopefully she'll be able to come back. All right. Well, so let me go to Grand Ronde Hospital. Oh, there you are. You came back.
Sorry, I froze.
So yeah. So give us about the last 30 seconds that you said, if you would, please.
Oh, I've already lost it.
Okay. It's all right. So,
Just, you know, we're really right now, we're focusing on the people that are at highest risk.
okay.
We're focusing on the people that are most likely to have a severe outcome. And if you've been following the deaths that are in our state of Oregon, most of the people are older adults that have an underlying medical condition. And so we're really focusing on protecting those the most, the ones that are going to have the hardest course of the disease.
Okay. So, I mean, we get all panicked about a lack of testing, and this just kind of sums up. But not having tests for everyone is not increasing the amount of people who have COVID. Correct? I mean, if we're all social distancing, we're doing, I mean, if indeed you can have it and you can move through it and never really know that you had it, then having being tested or not tested is not going to make you more likely to have it.
I would say that's probably a correct assumption, yes.
Okay, because I think what leads to a lot of panic in society is that it's like, oh, we don't have enough tests. Not everybody can be tested. And so then there is like, well, then there's a panic of, well, then that must, so the panic, I suppose, is that if we don't know we have it, then we're not as careful in contact with everyone else. But if we are all responsible in our social distancing, having tests or not having tests is not increasing the spread of the disease.
Yeah, and I think, we have a physician that's participating, so I feel a little uncomfortable providing medical information, but from what I'm hearing from the experts that I interact with is that we really do believe that the disease is primarily spread when people are symptomatic. So as long as we're keeping away from other people when we're sick and not coughing on them, sneezing on them, really, focusing on things that we talk about all the time when it comes to viral infections, then we're reducing the spread.
Good.
And again, our physician may have more information to share than I do, but that's what I'm hearing.
Okay, thank you. One other question. Can you give us any more information about the person who has been tested positive? Are they moving through it safely? Can you give us anything at all about that?
So actually, that's not information that I have because it's not information that I need to know.
Okay.
I mean, I think people think that I have information, a lot of details, but if it's information about somebody's personal healthcare information, I may not need to know it. So I don't know much beyond what we've shared publicly.
Okay, thank you. All right, well, let's go back to Grand Ronde Hospital. So some of the questions that we're getting is how many beds do we have? How many ICU beds? I mean, some of the specifics of, so if this does go sideways, then how is Grand Ronde Hospital how are they equipped to handle that? Let's say you have someone who does have a severe illness. Can you kind of give us an idea of how they would be handled, at what point they would be sent out? How many of those cases are we prepared to handle right here at home?
Sure. Elaine, do you want to answer the number of beds? And then I can answer the other question.
So currently our hospital is a 25-bed hospital, but with this incident, the CMS has waived that. And so we're preparing, part of what Matt talked about, the cots coming in, we're preparing for hundreds of beds. And that's really what we're preparing for. We're ready to take our floors that we currently have and provide the level of care that you would expect with no disruption. So we're gearing up to as many beds as we can physically hold.
Currently, we have 6 ICU beds, but the reality is that it's a staffing component too. Just because we may have a certain number of beds, we need to have enough of a workforce to be able to deliver that care. And so certainly we are activating preparing plans in case we have to redirect our workforce to help respond to an influx of critically ill patients. Certainly, If patients are really acutely ill, certainly we can still transfer, but we're also anticipating that other facilities that typically receive transfers from us may also be in a situation where they are full and unable to receive patients as well. Another advantage, though, that we do have, which is very fortunate that Grand Ronde was a very early adopter, is telemedicine. We have technology and robots in our hospital where we're able to essentially FaceTime or beam in a doctor from around the world that can help manage some of these patients at the bedside, but that still won't replace some of the procedural needs of a patient that are in our hospital. So that's where our care team right here in Union County is going to be instrumental in our response.
Good, thank you. The physician that is with you. Yes, would you like to respond on the previous conversation that we were having about, yeah.
Sure, absolutely. I mean, I think Carrie hit the nail on the head. So we're gonna be calling her up to work here in the hospital because she basically is a healthcare professional now. But no, she hit the nail on the head. I think the couple things that I would say, a patient asked me this morning if she should be personally terrified. And I drew for her the distinction between public health and your personal health. And I think the public health measures, as Matt pointed out, can be kind of frightening. You know, there's the National Guard and we have a trailer in our parking lot and people are all gowned up, and that makes people feel personally afraid. But I translated for her that that is a public health measure meant to help a lot of people, but not indicating that you, Jane Doe, are at extreme personal risk. None of us is at extreme personal risk. As a population, we're facing something unprecedented and need to take steps to protect our population. But I don't think any one of us, though we need to be responsible and follow all the measures that have been promoted, I don't think any one of us needs to be terrified or you know, overly anxious about our own personal health. Having said that, of course, we do need to show good sense. I want to second what Jeremy said. We are open for business. We think what I'm telling people is if you have symptoms that wouldn't have made you call the doctor a lifetime ago in 2019, then you don't have to call us now, right? But if they would have made you call the doctor then or come in, by all means, you need to call us or come in, or you need to call us before you come in. Seek care for what you would have sought care for before. Now, some people are choosing to put off elective surgeries for one thing, but other elective services like annual exams, eye exams, dental exams, perfectly reasonable. That's just another method of social distancing. And if it can wait, it can wait. We're still at work there. We're still refilling your prescriptions. We're still prioritizing your needs in terms of whether you need tests or labs or visits. We're there. We can give you that advice and help you to either stay home or to come into us. I saw non-sick chronic care patients all day today. We're not all there just swabbing COVID suspects. We're still doing our normal job, and we can help people navigate whether they need that done right now or not.
Thank you. So tell us how many ICU beds, how many respirators we have, and how, I mean, let's say we have a candidate who does have COVID-19, they're tested. I mean, at what point would they be treated? I mean, I know that's a difficult question, but I mean, kind of give us an idea of that scenario a little bit from the standpoint of Grand Ronde Hospital. I know because I've done video production for you guys that how telemedicine and the respirators work together, which is a very powerful thing. And we're very fortunate to have that here at Grand Ronde Hospital. But if we have more than a few cases, then how is that going to be handled? Give me an idea there.
Well, I can tell you that we currently have 12 ventilators. We've got 3 more that just arrived, I think today, and will be put into service on early next week. But it's really hard to speculate what that watermark's going to be in terms of number of patients in the hospital and the number of resources, staff, or when we'll need to get to a point where we might need to consider transferring. Again, we're more fortunate than most. We've got a great amount of supplies and resources and technology that has been invested into this hospital, into this community hospital. We've enjoyed tremendous support from our local community. That being prepared is not something new for us. We prepare all the time. This is just a little bit different because most of our preparations are for a mass influx of patients. That's a quick event, a bus accident, something that brings in a lot of patients that are acutely ill, and usually we can triage them, and some go home, and some might have a broken bone. This obviously is more slow moving and has a longer period in which we have to manage them. But again, we're in a great spot. We've got great plans in place. We've activated our emergency operations plan. We're continuing to work with state and federal authorities as well as our representatives to secure additional PPE. We've got a good supply now. At the same time, as we've kind of all alluded to, is we're trying to gear up and ramp up for what we anticipate is going to be a long haul as this disease.
And that was one of the other questions, Jeremy, on Facebook is what is Grand Ronde Hospital doing to protect your staff and employees and the frontline nurses and physicians? Can you respond to that a little bit?
Yeah, we're essentially, again, we've got an adequate supply of PPE and we're allocating that appropriately based upon, the CDC and or guidelines. Again, one of the measures that we've done is we've canceled elective surgeries and procedures to preserve PPE. And really that's as a precaution until the supply of PPE can get produced in a quantity where we can then start resuming some of these activities. I mean, our staff deals with infectious diseases all the time. And we have standard precautions, we have standard methods and cleaning materials and protective equipment that handles this all the time. We're prepared. Right now, it's a supply-demand issue, and until that supply can get bolstered, we're taking cautious approach to various services that we render. But Dr. Rice was spot on. There are still wellness needs and medical needs of our community that we can't ignore because we know that those will just get exacerbated down the road.
The other thing we're doing to protect our staff, I would say, is, for example, at the regional medical clinic where I work, and we have a walk-in clinic, we're making certainly we're screening all the patients before they come in for symptoms, but patients who screen positive, who are not necessarily COVID patients, but they're the ones we have to take a closer look at, they're kind of segregated, and only on a given day, certain staff take care of them, and they're segregated from the workflow of the rest of the clinic so that we're separating the sick and the well patients, which I think protects the staff as well as the other patients. And it's been a little bit of a hardship for the patients. It's extra questions to answer. It's just another one of the burdens that we're bearing, but it's been amazing how generous and wonderful they've been about doing it. They care about our safety. They've been fantastic.
Some of that care is even happening in the car.
Yep.
Again, we're I think showing our spirit of creativity and collaboration, and it's just been, I'm humbled to watch our team come together amidst this state, national, worldwide crisis.
I think our low population density has also given us a little bit of a head. I mean, this is great. We're getting ready. We are ready, and we're not overwhelmed from the beginning. So this gives us such a head start, I would say.
Well, I joke, that's one of the reasons why we love living in Eastern Oregon. We kind of like the social distance, being away from those urban centers. So
our lives haven't really
natural
changed
selection.
at all. Yes.
Yeah, excellent. All righty. Hey, Sabrina, do you have any follow-up questions that you would like to ask? There you go.
Yeah, there we go. One question that we had, and it was kind of a two-parter, and you answered it with how many ventilators you had, but we wanted to know how many respiratory therapists that GRH also has.
We currently have 6 respiratory therapists. We have staff, anesthesia staff, and so forth that can help us as well if needed.
And also in that, and I think this was kind of what Brent was trying to ask, but could you, I think people are wondering, what is the process when you get that positive diagnosis, when you get that confirmed case of COVID? What is the process for, because there's no treatment, there's no vaccine, what happens?
Yeah, we'll let Dr. Rice.
So depends. If it's a patient in the clinic who has mild symptoms, we're going to immediately send them home and isolate them and isolate their family, right, Carrie, and take care of it that way. If they're sick and they have to be in the hospital, then we're going to treat it the way we treat all viral diseases. And so this might mean that they need fluid so they're not dehydrated, that they need breathing treatments to open up their lungs, that they need supplemental oxygen or CPAP or to be on a ventilator. And then if a person's on a ventilator, there's a whole package of care that goes along with that. So it's mostly supportive. The other thing that you're doing in that instance is to look for secondary problems. People commonly, back in the day with in the 1918 influenza epidemic, some of them died of influenza, but a bunch of them got a bacterial pneumonia as a consequence, and that was then untreatable. Now it's treatable. So we're going to watch for it and treat it as a complication of the original disease. But a lot of people staying home. We have to stress that it's a lot of people are just going to be inconvenienced.
Is there any additional, and you don't have to go into what those measures are, but is there any additional measures when staying home if you are a confirmed case? As far as like how you isolate?
No, symptom control, just symptom control. If you have a cough, you might want to take a cough suppressant. For example, if you have a fever, you're definitely going to want to take Tylenol to keep that fever down just because it's miserable. That's going to not help the course of the disease. Now they're actively looking at things that may help the course of the disease, but right now at this time, there's nothing that we can say does that. And so this is going to act like anything else that we don't have a specific treatment for. And
is Grand Ronde Hospital at all in kind of that looking at different treatments and different, it's not vaccinations, but like, I know there's a lot of conversation and question about different hospitals coming up with different things that they're giving patients, medications that they're giving patients. Is Grand Ronde Hospital also looking at that, or is that just not in your guys' purview right now?
Whether we're involved in any clinical trials or anything like that, the answer is we're going to really defer to the CDC, state and national experts. Again, it seems like daily, if not hourly, guidance is changing. Sorry, my computer. And so certainly we're in close communication with various experts to make sure that as those developments come through, then certainly we'll want to be a part of those where appropriate.
I think it's very important, even at these difficult times, that any purported treatments go through some form of a regimented trial. It's not true that any treatment is better than no treatment, and there have been cases in history where the treatment was worse than the disease. So of course you're going to hear about this, that, and the other, but we would encourage people to follow the guidance of the CDC. The big hospitals and the big centers and the NIH can do fast, simple trials where they, if something does turn out to be effective, I think the procedures are in place to fast track it, but that'll come to us from above. We don't have the number of people to do our own trial whatsoever, or even to contribute to a trial if it were done in a multi-center fashion.
And then I would add that somebody sees something on social media or hears something on radio that seems to be good to be true in terms of an immediate cure, pause and call your provider, call the ER or whatever, hotline, Because again, we don't want anybody harmed for trying something experimentally that isn't proven.
Okay, that answers all my questions.
And thank you. I want to come back to something Dr. Rice said that I think is really important, and that is that even in this climate, you don't need to go to a physician for something you normally would not have gone to. So if you have a sore throat and cold, there's really no need to go to the walk-in clinic. You're just going to treat it like it's any other illness, along with the social distancing aspect of it. You want to restate that again? Because I think that was really good for us to hear and understand.
Me?
Yeah, yes.
If you wouldn't have gone to the doctor in 2019, don't go to the doctor in 2020.
Excellent. Because that's part of what potentially overwhelms the system, right? You have people that are coming in for, yeah.
Yeah, no, that's absolutely true. And I think in that sense, it's good to get out the word that we can't test everybody, because of course that's what they want, and they can't have it and it won't make a difference in their outcome. But letting them know that they're not going to get a test, then they can take a breath and say, well, I just don't know that I really needed to be seen for this cold, and they can stay home, and that's going to help everybody, them included.
So somebody tell us, what are the specific perimeters for being tested?
Well,
okay.
The Oregon, you'll correct me if I'm wrong, Carrie, but through the Oregon Health Authority, you can be tested if you have a bad enough lower respiratory tract infection to be hospitalized and a negative flu test, or if you have symptoms, fever, cough, shortness of breath, and have contact with a known COVID-19 patient, or if you have symptoms, fever, cough, shortness of breath, and known travel from a high incidence area. Is that correct? I think that's the latest. It changes frequently.
Yeah, the testing guidelines actually just changed. So I think that's part of the challenge that we're facing. And I really want to acknowledge that it's hard to keep track of what the criteria are because they do change. And I believe for a clinician like Dr. Rice, she can use a private lab to test anybody that she feels under her clinical discretion needs to be tested. And that's really up to her. For the Oregon State Public Health Laboratory, they're really focusing in on those high-risk populations that I just talked about. So they're looking at testing people in congregate settings, like those long-term care facilities where we've seen outbreaks. They're looking at focusing on household contacts more. And of course, I had all these things pulled up, but I have so many documents, I'm not able to find it. So the state lab is, again, focusing on the congregate settings, people that are hospitalized, like Dr. Rice said. And then if somebody passes away and there's an unexplained illness, we don't really know, the death was unattended, then those would be situations where the state lab would want to know whether or not they had COVID-19. But other than that, testing would be done at a private lab, and that would be at the discretion of the provider.
So one hanging question is, do we have enough tests to test all of the people that fit that criteria right now in our area?
Well, I mean, I can tell you that I imagine that a provider who has a patient that fits the criteria, who is severely ill with fever, cough, and respiratory issues, that has a negative influenza test, who has also not had any, been screened out for other respiratory infections, we could do a test on them. I think that what we're seeing is that it is taking the labs a bit of time to process those results. And so if we ran that test today, it may be a week or more before we're getting that result. Now, when I looked at the results that were reported out by the Oregon Health Authority today, it made me think that maybe some of the backlog is, they're starting to catch up. But I think that, again, we can run the test, but the processing time may be long depending on how much they're able to do in one day.
All right.
Brent, I'd say, yeah, if everybody lined up right now for the test, the answer would be no. Again, as we do a thoughtful review of each patient and just like we're trying to do with flatten that curve, I believe that especially in Union County where our population density, we should be able to process the testing but the lag is going to be, it's taken, 5, 7, even longer days to get those results back. Now, certainly if we had an influx of cases, then obviously that could bog the system down, but right now it seems to be going fairly efficient.
And again, if we had the ability to test everyone, 80% of those folks are going to have mild symptoms, and they're just going to move through it as though they were sick with a normal flu. They're going to isolate themselves. They're not going to, they're going to do everything that they can. And so even the testing lag, their decision to isolate is going to be the same whether they have a quick test back or not.
That's correct. And in medicine, we should always ask ourselves when doing any test, will this test change what I recommend or what the patient needs to do? And in this case, the answer is often no. We also have to remember that if you test me today with some sniffles and I'm negative, that doesn't mean I'm not going to have something else next week. And what, are you going to test me again? I mean, where does it end?
Right.
So I think we need to get away from that a little bit. And again, think of it in a public health sense of we all need to do these things as opposed to a personal health sense of do I or don't I?
Excellent. Okay, well, everybody want to have a last word? Matt, we haven't heard some cheerleading from you for a while, so why don't you start and we'll close up. Yeah.
Like I said, I don't know all the medical stuff. Grand Run Hospital and Carrie at CHD, everybody at CHD, you guys have been doing fantastic. I'm so glad we have you guys on our side. Absolutely amazing. JB Brock, Emergency Services Manager, is doing a wonderful job with the JIC, getting the information out. I just wanted to let everyone know that, hey, we're still here. The county's still running. The Sheriff's Department's still doing their thing. The city police, state patrolmen, we're here. We're working. I'm in my office. Call me. Concerns, please. I'm here. And thanks again, Brent, for doing this, and Jeremy and staff, everybody. Doing a great job. Thank you.
Excellent. Jeremy and staff, give us a last word.
And as I started off, again, we've just been humbled at the outpouring of support. We've had so many folks who have called and wanted to donate food, supplies. I've heard folks even can we sew masks? Again, I think that Eastern Oregon spirit is just alive and well. We've been fortunate enough to serve this community for many, many years. And it's humbling to be on the other end of this where the community is now serving us as well. And so, we're in this together. This isn't going to be a quick thing. It's not a sprint. It's going to be a marathon. But I'm confident in our team and our medical staff that we're going to get through this and we'll be stronger.
All right. Carrie, do you have any last thoughts for us?
I just want to reiterate the thanks for creating this platform for us to share information. I think it's really helpful for us to be able to talk to the community directly, so thank you. As a public health professional, somebody who studied my trainings in public health, I don't know that I ever, we train for this, we plan for this, we prepare for this, we study this in history, and I don't know that I ever expected that I would be, doing this work. It's hard to believe that we're responding to a global pandemic right now. And I think that one of the things that's been most meaningful for me through this experience is that all those partners that we've spent I've been in this job for over 10 years that I've been working with through my career at CHD and in the community, the hospital, the county emergency manager, all of our EMS, law enforcement, schools, like everybody that has come to the table and is working together to do everything they can to keep our community safe. I have just, I knew there was so much good in Union County, but I have got to witness it day in and day out. And I see people working tirelessly to, for the good of our community. And I'm just really honored to be able to be a part of it. And I'm really grateful to our community members for all that they're doing to help get good information out there, help reduce the risk to our community members, and really make it possible for our healthcare system to have the capacity they need to take care of somebody if they get sick, including my family. You know, I want them to be able to get healthcare if they need it as well. So again, I think I want to make sure that people know about our website, which is chdinc.org/COVID-19. I think we're trying to put local information there and fact-based information. So if you have questions, it's a great resource.
All right. Sabrina, do you have anything you want to say? All right. Well, hey, Eastern Oregon, I appreciate you tuning in, and really appreciate our panel and participants. You guys are, I personally feel very honored. You know, I'm not an easy person to scare, and so I'm not sure I'm a good measure here, but I am, you know, probably my three kids, one of them being a nurse at Grand Ronde Hospital, is always talking to me about being safe and doing the things that I need to do. And so I've stopped shaking hands. I'm doing the elbow bump. And I wonder, it's like, you know, the number of germaphobes that are going to come out of the other end of this. And it could be that like shaking hands will be a long held tradition. I was watching a movie last night and they shook hands, and for just a second, it was like, you know, I was like, yeah. So it's just it's a funny place we were at, but just want you to know that I really appreciate you doing this. And those of you that are in Union County that might be watching this, I just want to tell you that just remember the percentages. You know, I had a physician recently that I was talking to, and he said, the cruise example is like a giant petri dish, and if you had 1,000 people on that cruise, which they have more than that, if you have 1,000 people on that cruise and all of them were exposed in one way or another, you know, 80% of them were in isolation for 2 weeks and they went home, you know, and, you know, of that 20% had, you know, had some severe illnesses or some illnesses. Some of those were severe, but so there's reason for us to be prudent and faithful and do what we need to do. But we really, fear is just, I think that's driven a huge amount of stuff. And personally, that aggravates me when I'm motivated by fear. So all of these agencies you can ask questions with, and I appreciate you all being so open. And I'm going to end the stream, but hang on for just a minute and we'll have a little conversation afterwards. But again, thank you, Eastern Oregon Live TV, and thank you, The Observer, for jumping in with us and being a part of this. And thank you to our sponsors who make this kind of stuff possible.